أهلا بكم في تلفزيون CardioAlex. And with us now, Dr. Jack C.Lewin, Professor of Cardiology from New York, USA. Hello, Doctor. How are you? And welcome to
Very good. Welcome. Thank you.
Hello. What do you think about CardioAlex 2017, and is it meeting your expectation?
Well, this is my, I think, 11th time at CardioAlex. I always enjoy it. It's a wonderful meeting. It's really the most impressive meeting in the Middle East in the cardiovascular space, and I think every year it's better. It's a fantastic year this year with great science, great faculty, very exciting meeting, and it serves a huge purpose. Actually, I believe CardioAlex actually has lifted the level of expertise among the cardiologists by virtue of it's connecting so many people together to share information and education. And the result is the patients in the region are getting better care and having better outcomes. So it's a fantastic contribution.
Okay. What are you going to present this year?
This year I'm doing two things. I am looking at the digital health, the information age, and how that's going to transform cardiovascular medicine. A lot of, it's not just wellness devices and that sort of stuff. It's also biosensors, biomonitoring. In the next decade, people who have a risk of heart attack or coronary artery disease almost all of them will be continuously monitored with little patches like a Band-Aid, on your body that could read if your heart is getting stressed in any way and alert you by your cell phone and or your doctor that you need to be checked immediately. Similarly, if you have an arrhythmia or atrial fibrillation, we'll be constantly monitoring. And in this way, we will prevent complications, strokes, heart attacks, and other events. Heart failure is another important area where digital evolution is going to improve outcomes and greatly help both patients and doctors. And for those who have diabetes as well, we will be able to monitor blood sugar on a 24 continuous basis. So you can see if, in fact, your sugar's too high or too low. And while diabetes is a disease of metabolism, not just blood sugar levels, this is a way for us to know how you're doing. It's going to be fantastic. And there'll be many other things going on with telemedicine where physicians and patients will be communicating via interactions instead of in person. We'll be able to use technology to actually reach out to people faster and more conveniently. Very exciting stuff. So that's one of the topics. The other topic is about the costs of healthcare and the healthcare systems we all live in. And in the U.S., per person per year, we are spending $10,000 on average for healthcare. Here in Egypt, by comparison, it's $151. And yet, Egypt's having some pretty good results for a lot less investment. There's a lot of money being wasted in the U.S. So I'm talking a lot about how we have to really plan to be more efficient and effective in healthcare, and particularly with the very precious healthcare dollars we're spending, because nobody can afford it. Families can't afford it, governments can't afford it, businesses can't afford it. So we not only have to improve the clinical outcomes, we have to be watching what we do in the healthcare cost area, because healthcare is very expensive.
Okay. How do you see, what is the general future of cardiology?
Well, I can't believe there's any specialty in medicine that's more exciting than cardiology. If you think back to the era when I was trained, somebody had a heart attack, we gave them oxygen and morphine, and we put them to bed for a few weeks. I mean, compare that to what we do today. Well, we don't have any idea how much more incredible and sophisticated it will be in 10 or 15 years. Cardiology, we've made great progress, but it's still the number one cause of morbidity and mortality in the world. And it's only going to increase because of obesity, diabetes, sedentary lifestyles, people continue to smoke, and many other things that are still going to go on. So this is a great field. But a whole new dimension of the field is structural heart disease, where we're able to go in, obviously, with catheters and do things that required surgery before, not just angioplasty and stents, but now heart valves and congenital heart lesions, and soon many other interventions that we'll be doing. So it's an amazing time in terms of technology, engineering, and science. Wonderful field, and it's one that's going to help humanity in a great deal with much more progress.
Okay, and at the end, we would like you to say a word to the people all around the world that to come to visit Egypt and that Egypt is safe.
Absolutely. Egypt's a friendly, warm, and wonderful place, and I can tell you I'm from New York in the United States, and there are places in the United States that aren't safe. That's true of everywhere in the world. Egypt's a wonderful, warm place, great people, and a great future.
Okay, thanks a lot, Doctor, and welcome.
I'm glad to be here.
Enjoy
Thank you.
your day.
I hope that you enjoy and see you next year. Bye-bye.